This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo!
Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. The Speaking of Pets podcast is sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better. Hey everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist, and...
I'm Janet Novotny-King. I am the doctor's sister. I am not a board-certified allergist, dermatologist, or medically capable, but I am a pet lover and pet owner, and I kind of help to dumb things down so that us pet owners can be really, really good pet owners. So thanks for joining us today. Okay, Alice, so what's going on? Wait. I just went to a cookie exchange.
Okay.
Because it's holiday time. I know this gets aired later, but I have to tell you, one of my traditions with my two sons is I used to go to a cookie exchange when they were little, and what I would do the next morning for breakfast is I'd put out that big bucket of cookies with a gallon of milk, and that would be their breakfast.
Oh my gosh.
But once a year, it was a treat.
Yeah,
so now that they're adults, I don't know what's going to happen with this whole bucket of cookies I brought home.
Okay, so two things, Janet. One, you left out you're an animal rescuer.
I am an animal rescuer.
Okay.
Big time.
Secondly, this is a wonderful topic today. We have Dr. Jenni Rizzo, who's president of the American Heartworm Society. Now, what's neat about that is so many things, but you were telling me earlier, Janet, that you said, I don't really know anything about heartworm. I just give the pills that my doctor
tells me to. Yeah.
So I think it's great that we're going to go over the basics of heartworm disease, not only in dogs, but guess what, people? Cats get heartworm disease.
I didn't know that.
Yes, I know you didn't. And so we need to talk to Dr. Rizzo about that because it's as vets, this is kind of something new for us. This is a new field of heartworm disease in cats. But anyway, Dr. Rizzo is an emergency room vet.
Wow.
That comes with a million questions that Janet and I will have for Dr. Rizzo.
Remain calm.
That's right, at all times. Calm down. But also, she's the founder of IntroVet, and I'm especially interested to find out the officer named Petey that has something to do with IntroVet, which I have a feeling is not a human being.
I don't think so.
So welcome, Dr. Rizzo. We're so glad you joined us. We have so many questions that our viewers actually have submitted to us, too, about heartworm. And Janet, why don't you start?
Okay, so Dr. Rizzo, let's just start with, well, first of all, can you give us a little background on you, like where you got your degree, where you grew up, that kind of thing?
Yeah, sure. I was born in Kansas. I grew up around Wichita, Kansas.
Wow.
I graduated from Kansas State University vet school. And then I practiced for about 9 years in Texas, another 4 now in Florida. And I'm actually currently in Texas right now for the holiday and headed back home to Kansas tomorrow.
Wow. Oh, that's great. So let's start at the beginning because, I'm a pet owner and lover, and I just give those tablets to my dog because I was told to do that on the first of every month. So what is heartworm?
Heartworms are a worm, a physical worm that can grow to up to 12 inches long. Yep, so you can... Inside the body, you can picture them like a spaghetti noodle. They live in the blood vessels, and they prefer to stay in the heart and lungs because that's a large space where they can fit into blood vessels where it might be harder to fit other places in the body.
So what happens when a pet, now I know cats, so dogs and cats, when they have heartworm, if they're not cared for?
If it's not prevented.
Correct.
Right. If heartworms are not prevented, then dogs contract them and cats first through a mosquito bite where they're microscopic in size as tiny little babies. They make their way through the body towards the heart and the lungs where they grow up there into that adult 6 to 12 inch length. And then while they reside in the heart and lungs, they start to cause all sorts of damage and inflammation. They cause thickening and hardening of the blood vessels in the heart and the lungs. They cause enlargement of the heart. And eventually, if they're left there long enough, they cause heart failure and are fatal to pets.
So once your pet gets heartworm, is there anything that can be done?
There is. For a dog, there is curative treatment. We can kill the heartworms effectively in a dog and allow them to go on and have hopefully a normal quality and length of life as long as the disease was caught early enough. In cats, there is no approved treatment, and so we don't have a way to safely kill the heartworms once they've found their way into a cat. The best we can do is try to control the symptoms of their disease, and sadly for many cats that means that their life expectancy is much shorter because of heartworm disease.
So how do you know when a dog or a cat has heartworm?
You typically would find out through a blood test that your veterinarian would do. That's how most cases are diagnosed. If a pet isn't going to the veterinarian regularly and the disease goes on long enough to start showing outward signs, then you might see things like coughing. Your pet might slow down, have trouble, playing fetch or doing normal activities that they used to enjoy. Or in really bad cases, you can see them in all-out distress, just unable to breathe.
So it's kind of like when I know our old dog Shaggy had Lyme like 3 or 4 times. And I could tell when he got it because he'd have trouble getting up. So if your dog has a change in behavior, you should definitely go to your vet and have the vet assess which tests need to be done. And I would hope that a veterinarian would test if there are symptoms for both heartworm and Lyme, right?
Yes, I do. I think it's fair to say that most veterinary offices, especially those that know they have ticks around, do a blood test that checks for multiple things at once that includes tick diseases
Okay.
alongside heartworm.
Wow.
And Janet, you know what's really sad about all of this? And by the way, Dr. Rizzo, I watched an excellent webinar by Dr. Starkey last night on heartworm disease
Heartworm.
and the latest updates. But it's so sad, Janet, that this disease is totally preventable.
Yeah.
By that either monthly heartworm pill or a topical or a 6-month or a 12-month shot. I mean, it's totally preventable. And it's not, the price of it is not doable. Let's just say that.
Right.
But sadly, if they do have it, the treatment can be very dangerous and not to mention expensive. So something that could have been prevented and you could lose your dog over it, it's just heartbreaking. Or cat, actually, too.
Well, and I have to say, as a pet owner, like I have that auto ship thing, like you can
Yes.
do them in different, and it just comes every month. It's really quite fabulous because then it's also a reminder for me as a pet owner to do it.
And Dr. Rizzo, the other thing, I'd like you to comment on this. People that, say you live in Minneapolis, okay? Janet and I are from Cleveland. So it's cold there. Although it's not as cold as it used to be, I'll tell you that.
No, it's not.
Ever since we've been coming to Florida, the winters aren't bad in Cleveland. But that's another story. But some people don't believe in giving the heartworm preventative all year round. And would you speak about that? Because I'm a believer in all year round heartworm preventative.
I thought it was every month.
Yes, certainly. I can speak to this. You know that saying, nature finds a way? Heartworms and mosquitoes that harbor the heartworms find a way to survive through the winter. We've actually done some interesting research at the Heartworm Society to actually measure and confirm that mosquitoes survive the winter in places like Minneapolis in little pockets of warmth around your heaters, in your attic, in your garage. They come inside and they hide out for the winter, and so they can continue biting pets and people and spreading heartworm disease even through the winter by finding these little pockets of heat. A mosquito is a tiny creature and it only needs a tiny bit of heat to live, so it can be hot or cold outside and still warm enough in your house for those mosquitoes to thrive through the winter. That's how they continue on in this process.
So but heartworm is not contagious. Like if I took my dog to a dog park and a dog had heartworm and I didn't know it, it has to be transmitted through the mosquito bite, correct?
Right, it has to be transmitted through the mosquito bite. It's not transmitted instantaneously from dog to dog.
Okay, good.
But if you live in an area where there is a heartworm positive dog or coyotes or foxes or other wildlife that can carry heartworms within your neighborhood, then the mosquitoes that also reside in your neighborhood will be carrying heartworms as well. There was a study done that showed that if a heartworm positive dog was living in a backyard, they collected all the mosquitoes in his backyard and tested them, and about 75% of the mosquitoes in that dog's yard were carrying the heartworms from that dog. And then within a few weeks' time, they can go spread it around to everybody else in the neighborhood.
Dr. Rizzo, I work with Golden Retriever Rescue in Florida and in Ohio. And probably, I would say, once a month, once every 2 months, we get a heartworm positive dog. And some of our dogs are mill dogs from the Amish, and our head of the rescue tries to extol on them the importance of please have these dogs on heartworm prevention. But yeah, right now in Southwest Florida, we just got a rescue in where she's starting heartworm treatment this weekend. So I can't stress enough the prevention and how important that is. And you brought up a good point, Dr. Rizzo. Everyone now seems to have coyotes in their neighborhood. And here we have bobcats too. And so these wild animals are carrying this disease. If a mosquito feeds on that coyote or bobcat and then bites my dog, they've got it. So Dr. Rizzo, tell me what's going on with heartworm disease in cats, because I know they just came out with some new news about that.
So heartworm disease has always been a problem in cats. It's just that not as much research has been done relative to dogs, and so we just don't know as much about the disease in dogs as we do in cats. And as we mentioned earlier, there's no curative treatment for cats once they do contract the disease. And so what the Heartworm Society has done this year is released an updated set of guidelines for veterinarians, just re-emphasizing and strongly encouraging all cats to be on heartworm prevention because we know the disease is deadly for them if they contract it. And also recommending that cats start to be tested on a routine basis so that we start to gain a better understanding of how widespread heartworm disease is in cats. We know from a few studies done in animal shelters that the prevalence or frequency of heartworm disease in cats was about the same as that in dogs. And there's been this sort of misunderstanding, I think, in past decades that heartworm disease was not a big deal in cats and just a big deal in dogs, but we're finding that's really not the case.
And the symptoms are different, aren't they?
They
Between
can
dogs
be
and
different. Cats can die suddenly with no prior signs of disease, which is the scariest part about heartworm disease in cats, or they can have symptoms that don't obviously seem like a heart or a lung problem. They can just be vomiting, or they can just be a little bit tired. Sometimes they have a cough and sometimes they don't have a cough, and so it does show up differently in cats than in
So
dogs.
as veterinarians, if we find that someone's cat is heartworm positive, it's not like we can treat them for it like we can for dogs. So what is usually done?
Well, we try to focus on reducing the inflammation that causes some of the signs that we see in cats, and so steroids are something that are commonly given to cats. And actually, a lot of heartworm disease in cats we think is misdiagnosed as asthma because the signs overlap and the appearance on x-rays can be very similar. And so if we're not in the habit of checking for heartworm specifically, it can be easy to look at a sick cat with signs of asthma and call it asthma instead of digging deeper to call it heartworm disease. And so if you think about asthma treatment, inhalers, steroids, anti-inflammatory type medications, that's similar to how we try to help with heartworm disease.
Now there's soothing relief for your pet's irritated skin from allergic response, contact allergens, and insect bites. Atopicreme HC by Vetramax is a unique anti-inflammatory, rehydrating leave-on lotion conditioner for animals that is quickly absorbed, providing sustained benefits while leaving no residue. Fortified with ceramides, these lipids help restore the skin's natural protective barrier and aid in healthy skin regeneration for your pet. Atopicreme HC is made in the USA and not only provides quick relief for irritated skin, but it's also an aid in detangling your animal's coat. Ask your distributor about Vetramax products. Vetramax makes it better. Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems. They make a food allergic diet that's an alligator-based called NP, or a hydrolyzed salmon-based for dogs and cats called HF. So please ask your veterinarian about Blue Buffalo prescription diets. You know, Janet, when I was watching that webinar last night, and by the way, the American Heartworm Society's website is wonderful for information for pet owners. But when I was watching the webinar last night, they showed an x-ray of a cat that had heartworm, and the stomach was this big, full of air, because it couldn't breathe, so it was just trying to get air in. And I thought, oh, that poor cat, it's suffering. There's nothing worse than when you can't breathe.
Right, it's a really sad situation.
They don't make inhalers for cats, though, do they?
Oh, yeah.
Oh,
They-
God. Okay,
they-
first of all, a pill and a cat is a problem. An inhaler and a cat would be suicide in my house.
We actually use human inhalers, but a special mask that's made for cats that you attach to the end of the inhaler, and it's not so bad. It's actually pretty easy to give. I think easier than the pill.
You're going to come over because I'm telling you right now.
Janet, get on a plane with those cats and get to Texas right now.
Well, and the sad thing is, Dr. Rizzo, like Alice just was telling me that cats get heartworm, and and I'm neurotic about ticks, having had Lyme disease, and I don't
And
even.
Janet's in Connecticut, by the way,
I'm in
Dr.
Connecticut,
Rizzo.
the start of it all. But I don't even put those drops on the back of the cat. Like, I have it behind my back, and I go, and they go, and they hear me. And then by the time I get there, they're already like flying through. So anyway, we have to be better about that in the King household.
Do you see what what I'm dealing with here, Dr. Rizzo? Because I said to her before you came on, I said, well, your cats are on, Janet said, well, what's this heartworm in cats? I said, well, your cats are on Revolution Plus because I call it in as a refill. Oh, we haven't used that in months. I'm like, oh.
Plus, the cats do sleep in our beds, which
You're
is
a horrible client, let me tell
I'm
you
a
right now.
horrible client. I know.
But let me
Horrible,
tell you
horrible.
this too. There's an interesting fact that, 68% of clients leave a vet office without any heartworm preventative being dispensed. That is like horrible. Because think of the ones that don't go to the vet. You know none of those pets are on
Yeah.
heartworm preventative. Oh, I
And
couldn't
it's
believe
like the
that
dogs,
statistic.
like, they must taste good because the dog loves them. I haven't had any dog refuse that heartworm pill. They love it. It must taste good.
Yeah, they're pretty tasty for most dogs. Cats are trickier because they're more suspicious of anything that we want to give to them.
Yeah.
But I have luck having clients offer special cat treats when they're applying the prevention. Do you guys know about those churu snacks that you can buy them now at the grocery store, but they're like a paste that's tuna flavored or chicken flavored,
Yeah.
and it looks like a Go-Gurt pack.
Janet, they
for
had them at
Oh,
TJ.
they
They
had
had them
them
at
I
TJ
saw, it's
Maxx.
like, it is like a
In the
little
pet
go-gurt
section,
pack.
yeah.
But how do
Yeah.
I do that with the pill?
Squeeze it up. Yeah.
You can cover the pill in the paste, yeah. Or if you've got your Revolution Plus that you're giving your topical medication, you have somebody feed the treats and then somebody else apply the medicine while they're not paying attention.
And you know,
I
Janet,
literally wear oven mitts to do
Janet,
this.
next
But
time
okay.
you come to my house, I'm going to show you how to apply it on a cat because you know, this is you. You're going 1, 2, 3, 4 drops. You got to go quick with those drops
Well,
on the
I
back of the
do,
neck.
but they run when they hear it go. They
Yeah,
fly.
okay, you're right, and mine know that too. So I do that in another room or out in, you know what I'm saying?
The things we do.
You're making a big production out of it, and you got to just kind of mosey up to them and go, nice kitty, and you're done.
I hope those nice kitties come in here right now. And the male cat will not because I'm in here. The girl cat might
Yeah,
show
I
up, and
know.
then you can see what I'm dealing with here. So, Dr. Rizzo, tell us more about the American Heartworm Society, how it started, when it started, your role, how do you get funding?
The American Heartworm Society started about 50 years ago as an organization with a mission to improve understanding of heartworm disease, both for the general public and for veterinarians. And prior to that time, there was not a well-organized group specifically studying this one parasite. And so over the past 50 years, we have accumulated a large body of resource and research and lots of very helpful resources, both for veterinarians and for pet owners, to help all of us just start to get on a similar level of understanding as to what heartworm disease is, what it does, how we can prevent it, how we can treat it. We receive all of our funding through veterinary sponsors, And but it's very important to us that everything remains non-branded, and that we want families to use any heartworm prevention that works for them, whether it be a pill, a topical, an injectable treatment. There are preventives. All heartworm preventives, we haven't mentioned this, but all heartworm preventives cover other types of parasites too. And so depending on what part of the country you live in, you might want to choose a prevention that also protects against fleas and ticks. Most of them protect against things like roundworms and hookworms that are something that can be spread from pets to people and can be especially dangerous for children and elderly people. And now I'm off on a tangent, but
No, that's
our,
what we're here for, to learn more about y'all.
yeah, we exist to teach things like this, to make sure people understand what the disease is, how important it is, and how we can prevent it, because it's fatal, and that was recognized 50 years ago, how dangerous it was and how little was known about it. And so in the last 50 years, all of our efforts have been to try to stop pets from having to die from this disease anymore.
Wow. So
You know what?
I'm looking at the map that they have on the website's fabulous.
Yeah,
And we'll flash
yeah.
that, we'll put that up on the screen. But the heartworm incidence and 100 plus cases per clinic, it's kind of like Texas, like kind of southern. Is there
Yeah.
a reason for that? Because the mosquito population's big? I don't
Yeah.
know. Oh, but
It
there's a
is-
little pocket up here in New England. Interesting.
So heartworm disease is most common in areas with lots of mosquitoes. So if you think about the hot and humid south, or along the Mississippi River, along any body of water, it will be most common in those areas. But in maybe the past 10 or 20 years, I think we've probably all noticed that pets travel more with us now than they used to, and that rescues are more involved in trying to move pets to whatever parts of the country where they're most able to be adopted, or most likely to be adopted. And so that has caused the distribution of heartworm disease to change to some degree. And so now, where maybe we didn't see as much heartworm in the Northeast, we see more of it now.
Alaska's not even on the map.
It's true. I maybe
Dogs don't want to live
misquoting
there.
this. Yeah.
No, mosquitoes don't.
That's right.
I think there's been one case of heartworm disease diagnosed in Alaska in a pet that traveled there from the mainland United States. But
Gosh.
I could be wrong in that statement. Probably someone else on the Heartworm Society board will know and chime in if they hear this.
But
I
that's really interesting. Wow.
Yeah, Janet, I don't think you realize that, like when they do a lot of rescues from these dogs in the South and they transport them up to Connecticut or to Ohio or Michigan, you may be taking a heartworm positive dog up there,
Correct.
and then those mosquitoes up there feed on them, and then it spreads it.
Sure.
Yeah.
Yeah, I want to be really careful not to discourage
Right.
the
Right.
rescues who do that, because those dogs wouldn't have a life anymore
Oh,
if they
sure.
hadn't
Right.
been
No, you're
transferred.
right.
Because I've practiced most
Yeah.
of my career in South Texas, in the regions where dogs get transported from the south to the north. So they need that opportunity in order to continue living and having a family at all. But it does come with a consequence if those dogs aren't tested and treated and managed before they move up there, which sometimes happens.
And this is interesting too, that ferrets get it.
They do. Yep. They can harbor heartworm disease as well. And typically in practice, I'll give ferrets the topical heartworm treatment products that are safe for cats. But there is one product that's labeled for heartworm prevention in ferrets.
Wow.
I'm just curious, Jenny, do maybe no research has been done, but say, do wild, like lions in Africa get it? Or don't we know? Has no research been done there?
There's been some research on zoo animals, and seals and sea lions can get heartworm disease. Big cats can get heartworm disease. Any wild canid, so wolves, foxes, coyotes, they can all get heartworms. Yeah, so lots of zoo type animals can contract heartworms as well, and are on heartworm prevention if they live here in this country and are at a zoo.
So is all heartworm medication prescription? Do I need to have a doctor prescribe that?
It is all by prescription, yes. And we do that so that we can make sure pets are getting tested every year for heartworm disease, so that the disease can be treated if you have it. And we don't want for things to go undiagnosed and think that you're doing right by your pet by giving them prevention every month, but they actually already have heartworms or accidentally got them during a month that a dose was missed. We want to keep track of those things. So it is by prescription.
So what if I do, and with the dog, we're not talking about the cats because we know
Okay.
I've screwed that up big time. But what if I do miss a couple of months? Like, oops, I forgot. Then I just keep the treatment going?
Good
Or
question.
do I need to have my dog tested?
If you do miss a couple months, you want to restart right away as soon as you remember and let your veterinarian know so that they can schedule a retest for you. And they will choose the timing for you to make sure they're able to test at the correct time to know if your pet got infected during those months that they missed doses. Because it takes about 6 months for a test to turn positive once a pet has actually contracted heartworms. And so they may or may not do a test the day that you call them, but they will do a test 6 months later.
Wow. So that little bugger's like growing.
And producing babies.
Mm-hmm.
Baby little heartworm called microfilaria.
Oh. Oh, that just gives, okay.
You know, Janet, also, when watching that webinar yesterday, they also emphasized mosquito control. Because if you don't have any mosquitoes, then they don't get the heartworm. But you can use like a repellent thing on dogs, but you can't use it on cats because it's too, they have too many adverse effects. But you know, like not having standing water, like, you know, we had here with 3 hurricanes, you know what I'm saying? No standing water, that kind of thing. Getting rid of like old tires and crap in the yard that holds
Oh,
water
the whole
in.
water.
Yeah, even spraying the yard too.
Yes, all those things we recommend doing all of those. Anything you can do around your property to control mosquitoes just makes your pet that much less likely to contract heartworm disease.
You know, when you think about it, our pets are really subjected to all kind of infectious diseases from these insects. I mean, really, Lyme and Bartonella and Babesia and heartworm from mosquitoes. I mean, it's like a crazy insect-laden world out there.
Don't they say that insects are the densest population of all the creatures on the earth? And certainly a lot of them are out there spreading parasites and viruses and bacteria.
When I go to visit Alice in Florida, she's like, I don't feel anything. And I literally have every no-see-um in the entire state.
You and my
on
husband,
body.
I'm
It's
telling you.
horrible.
And you know, Jenny, she got home, 2 days after she got home, she sent me a picture of her legs. And the bites were like crazy. It was, they love you, Janet, for some
And I
reason.
have to send you more of that stuff. There's only one thing I use. It's a commercial. Ranger Ready, whatever it is.
I'm looking at it
works.
right now,
And
the
I
spread.
literally coat myself in it. I feel like
Yeah.
a toxic waste dump.
Yeah.
Now, is there anything else that our listeners should be aware of in terms of heartworm prevention in their dog or cat?
Oh,
know-
I thought of something I want Dr. Rizzo to address. Janet, you mentioned you give the heartworm pill the first of every month. Isn't it important, Dr. Rizzo, that it's every 30 days?
Oh,
Or is that not an exact science there?
It's important that it's every 30 days. If it's every 31 days, you're not hurting anything at 31 days. But yes, every 30 days, the first of the month, both of those are effective. You just want to make sure that you're not giving it the first of the month 1 month and then the 15th or 20th or 28th of the month the next
yeah.
month. That's the part that is
Okay.
important. And for me, I'll be totally honest, I need time to think about things sometimes before I remember to actually do them. So at the first of the month, I go, it's a new month. It's time to think about prevention. And then by the 10th of the month, I give it every month. So really, my dogs get their prevention on the 10th.
On
But
the
I
10th.
spend that first week of every month going, it's almost time. It's almost time.
it works for you though. Your
Yeah,
sister.
it works for you. That's right.
I have a sticker inside the cupboard that has the 2 names of the drugs, so I don't forget that it's the 2
Right.
things for the dogs. But now I got to add the cat thing. We're going
You
to
know,
get
it's-
the cats.
If
It's
you're a
funny-
person who does lots of Zoom meetings, you can put it on your calendar, just like it's a
Right.
work meeting, so that you remember to give it. Having it sent to you in the mail once a month, I think, is another nice way to remember if you check your mail.
Oh,
I
that's
don't check my mail very often.
Well, and the product that I use comes with a sticker that you can stick on your day planner or whatever, if you have one.
You're such
Right.
a client, Janet. That's what I love about you.
I am a client.
You
That's
are.
why I love calling Alice at 2 a.m. Oh my God, she's throwing up. What do I do? Talking
No,
about
no,
the dog.
Jenny. The funny thing was when the cat was way up the
Oh,
tree, and all I could see was her or her husband, both in their 60s, climbing up a ladder and somebody falling. And so thank God the
That cat,
came
I'm
back.
telling you, Dr. Rizzo,
Okay.
it was way up there. It was stuck in a squirrel's nest. So it couldn't, it was like a bed of leaves, and you could, where the tree went like this, there were like leaves, and she
Janet,
couldn't,
cats can back down the tree.
well,
They-
she kept trying, and
Oh
it's,
my God.
I got to tell you, Dr. Rizzo, I'm in the backyard and I hear her, and I'm going, like, and then my son called, he goes, oh my God, and she was way up there. So what we did, well, Alice had put wet cat food out, which my cats never had wet cat food.
And I had no clue that every cat I know, you either turn the can open or open that, and they run for miles around. Her cats only eat dry. So that idea was out.
But I'm thinking, well, the doctor told me to do this, so I'm out there with the can, and the next thing I know, the golden retriever comes in with the can like empty, lick clean. Salmon pate.
Probably with tongue lacerations from
Right. Lick clean. And so then eventually what happened was if we shake the treat jar, the hard treats,
Yeah.
I think hunger overcame fear, and she came down like 2 days later. But the whole neighborhood was in on it. It was like,
But Dr. Rizzo, we did find out after having one of the Clevelanders on our podcast that there's a person named Tim in Cleveland that runs a service for cats that are up trees or on roofs of houses.
that wasn't going to help me.
No, I know. And I bet he would charge by the mile to come to Connecticut.
Oh, and you don't know, my husband was like, calling the neighbors, do you have one of those big ladders?
Oh,
Just going
my
up 3
God.
high?" And I'm like, you're not going up there. No, this is the man. Don't tell him I told you.
But Janet,
Good.
I
Wait,
want to
he's
know.
good.
I want to know about Petey.
Oh yeah, who's Petey?
Yeah.
So
Is he a
Petey,
ferret?
he's a dog. Petey or Pistol Pete. He's
Pistol Pete.
near me
He's
somewhere.
backing.
Yeah,
Backing.
Pistol Pete. So he is my dog. I got him when I was working in Corpus Christi. Somebody found him in a box as a tiny little puppy, mostly starved, very sad and sick. And I didn't think that he would survive, but he did. And then he became my best friend.
Where's
Uh,
Petey? We need to see Petey.
He's taking a nap in the other room.
Petey. Petey.
Maybe I can get him to come out.
How old is he now, Jenny?
He's 11.
Oh
wow.
my
Hear
gosh.
him. He's thinking about coming over.
He's thinking about it. It's like the cat.
He might be camera shy. Oh, here he
He loves-
comes.
Petey, here he comes. Petey, come here, buddy. Oh my God, he's so cute.
Look at that.
And look, he has a Stanley Cup.
Yeah.
Petey, you're adorable.
Yeah.
Tell us
so
about IntroVet too. I think that's fascinating. I was reading about that.
Petey is our chief executive dog. That's his title around the office. And so he helps lick envelopes and stamps. And he lets us know anytime there's someone at the door. Most recently, IntroVet is an introvert-friendly continuing education group for veterinarians. So we teach classes to veterinarians to help further their education, because veterinarians go to school for their entire life to make sure we always stay up to date. Most recently, Pistol Pete was at a conference that we had here in San Antonio down at the Riverwalk. He joined in, he sat at a chair, he sat in the front row, and he listened very intently while we talked about dog behavior. I think he was critiquing the speakers to see if they were correctly identifying his behavior cues. But he brings a lot of joy to all the people who get to meet him. He's
I love
gets to work
that.
with me every day of his life.
Oh, that's
Did you
wonderful.
drive to San Antonio or fly with him?
We drove.
Now there's soothing relief for your pet's irritated skin from allergic response, contact allergens, and insect bites. Atopicreme HC by Vetramax is a unique anti-inflammatory, rehydrating leave-on lotion conditioner for animals that is quickly absorbed, providing sustained benefits while leaving no residue. Fortified with ceramides, these lipids help restore the skin's natural protective barrier and aid in healthy skin regeneration for your pet. Atopicreme HC is made in the USA and not only provides quick relief for irritated skin, but it's also an aid in detangling your animal's coat. Ask your distributor about Vetramax products. Vetramax makes it better. Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems. They make a food allergic diet that's an alligator-based called NP or a hydrolyzed salmon-based for dogs and cats called HF. So please ask your veterinarian about Blue Buffalo prescription diets.
We've been doing a little tour around the country the past few months. We've been visiting national parks and I'm just seeing all kinds of new sites, and it's been really a fun adventure. We learned that a lot of the national parks have this program called a Bark Ranger program. So Petey's been crowned a Bark Ranger now at 4 different parks.
We need pictures of that.
Yeah.
Okay, so which
I'll
parks,
share them with you.
which parks have you been to?
Because Janet's going.
I'm going.
So far we've been to Acadia National Park,
I mean,
the National Seashore in Cape Cod, Shenandoah National Park, New River Gorge,
Wow.
the Smoky Mountains,
huh?
and I feel like we've traveled to more. There's one in South Carolina that's a big swampy national park, and we
Yeah.
went there. And then when it's warm again, we'll go towards the western half of the country and see some more.
Janet, you might meet her there when you go.
So we're doing the Grand Circle. Do you know what that is?
No, but I
You
have
go-
a feeling it might be similar to what I'm trying to do.
So I'll send you my spreadsheet because I've got it all planned out how long it takes you. But we fly into Vegas, and then you start at, we're going to the Hoover Dam, which is super cool. Then the Grand Canyon, and you do the Arches. You do like 10 parks in 10 days.
Yeah, we're gonna visit, Petey and I will visit all those parks in 2025, but I didn't know that it had an official name, and we're gonna take longer than 10 days. We'll probably spend a couple of months.
Well, and I don't know if you have a Pinterest account.
I do not.
Well, there are people who have it planned out, and you just download their map and tell you like the top 10 spots at Arches to go to. And the other cool thing is in the United States, you can get this pass. It's the Senior America the Beautiful Pass. It's $80 a lifetime, and I get to get into all the national parks with my carload of people.
But Janet, she's not a senior like we are.
No, I know, but it's a fabulous. You can live for this. Like you can,
Oh,
Duke,
okay.
Duke, your birthday's coming up. You can make this a goal.
Got it.
But
Are
I
all the
just-
national parks pet friendly?
I
No.
believe so. No, not all of them.
Not
You're
all
right.
of them.
Oh.
And some have pet-friendly trails and not pet-friendly trails. So you
Okay.
I always stop at a visitor center and check to see where the dogs are allowed to
Yeah.
be before we just head out onto the trails.
So I just visited, it's under the national park umbrella, but it's
Mm-hmm.
a national historic site, I think.
Mm.
And it was where they planned the landing on the moon.
Oh, yes, yes. You
So,
sent
and that was
that
was in
Utah or was that Utah or Idaho? You sent me pictures.
Idaho. And my God, it's the name of it, it's blanking on me.
It
And I
just
gotta-
is barren. Yeah,
It was black, it looked like a black comforter.
yeah.
For acres and it's like 60,000 acres, and you get to walk on it, and that one does not allow dogs, but it was really, it's one of the least traveled because it's kind of not easy to get to, but it was like 3 hours out of our way, and we're like, let's just do it, and it was super cool.
Cool.
So I'm a big national parks fan. They're very well taken care of, and actually the person who started was the head of the national parks, is Stephen Mather Jr., and he's from Darien, Connecticut, where I live. So his homestead is here where his parents, where he was raised, which is pretty cool. Well, Dr. Rizzo, we have to ask you the question we ask all of a couple questions we ask all of our guests. One, what are you most passionate about in the amazing work that you do? And secondly, what is your pet or human peeve? Like, what just gets to you?
Ooh, these are
People who ask
great
questions.
questions. So, I don't know if everybody knows this, but most veterinarians are introverts. You may not be because you're running a podcast. Maybe I'm wrong about that.
I'm actually very shy. Seriously.
And so I am pretty passionate about trying to help other veterinarians and veterinary technicians, anybody in this field, have a place to go where they feel understood and where they're not under pressure to act like an introvert. And so that's why I started IntroVet Academy and
That's
IntroVet
great.
courses that we lead.
I love
I'm
that.
very passionate about that. I'm also really passionate about families understanding that heartworm prevention is super affordable and important. I hear so much in practice that families think that it's expensive or think that they can't afford it, when honestly there are several out there that cost $6 a month, and
Yep.
the last coffee I got from Starbucks cost, I think, $8.25.
Yes,
Yeah.
yes,
You're right.
absolutely.
You're right.
It's
I totally,
necessary.
and you know
it's
what? I
not-
use that same comparison. You can spend $8 on coffee at
On a lot.
Starbucks, sometimes every day. And
Yeah.
we're just asking you to spend less than 10 a month to prevent a horrible disease. I totally agree.
As a consumer, as a pet owner, what if I accidentally give the pill on the 1st and the 10th?
You give
Like
it twice in a month?
Yeah. Is that the worst thing?
No, there's no problem with that. It's fine. Heartworm is also very safe. Heartworm prevention is very safe.
That's good to know. No, as a pet owner, that's good to know.
You know,
And
Janet,
another
let me,
thing-
oh, go ahead, Jenny.
Go ahead.
I was going to say a fun fact about heartworm prevention is that the original heartworm preventive, which is ivermectin as an ingredient, was derived from soil, from samples of dirt. So, if you want to think about using all natural products, that's about as natural as it gets.
Wow.
And Janet, let me tell you about the safety. There's a mite called Demodex mites, and before we had what we use now, we used to use one, I'm not going to even say the name of it because I don't want people to do it, but we used to use one of the heartworm preventatives twice a day, every day, to kill this Demodex mite. So imagine you're giving one of these once a
Right.
month, and we would be doing 2 a day for months at a time. So the safety factor is just
Okay, good.
fabulous.
Good.
There's no
And
reason
I'm glad
not
to
to
know,
do
like, the 1st of every month is okay, even though February's 28, at least she's getting it.
And you know what? It's fun to listen to the two of you because I have my date book here, and 2 months ahead, I'm counting 30. Okay, heartworm preventive Annie, heartworm preventive Gidget, another 30. I'm so obsessed with it that I'm going to miss it. Yeah.
Okay, even when I'm on antibiotics, like with the Lyme thing,
Yeah.
that I was very 6 in the morning, 6 at night, 6 in the
Yeah.
morning, 6 at night, just because of the way it works.
Yeah, but I always thought, Jenny, you'll probably agree with this. One time on one of our tests when I was in vet school, the question was, your dog as a veterinarian, you didn't give the rabies shot and now it was exposed to a rabid animal. I'm reading this test question, I'm like, oh, how could you as a veterinarian not get your dog the rabies shot? But you know what? We're treating everybody else
Yeah.
that the cobbler's kid wears no shoes, and here
Right.
we're letting ours go, and now I get it. But as a vet student, I was horrified by that question. It's just like Jenny with you. Oh, the first of the month, okay, I better start thinking about heartworm. Okay, I give it on the 10th. But it's totally believable because we're treating everybody else and up at 2 in the morning worried about our patients. And then there's our own dog sitting there, like the nails need to be trimmed, all that jazz.
Thank you so much, and really appreciate the work you're doing, and it made it a lot more understandable for me. Now I know I'm a
Janet, I have to applaud you because you asked some really good questions. Because I was going to probably talk to Jenny about all the people we know we have in common, but you.
Yes, that's why I'm here.
I know. But
Voice
the
of
other
the
thing
pet
too,
owner.
we're going to have a link to the Heartworm Society and to IntroVet, and also we want a lot of PD pictures because just the brief glimpse we got was pretty cute.
He's
Yeah,
adorable.
I have tons of pictures. I'll send you some where he's showing off his Bark Ranger badges, where he's listening in lectures at IntroVet. I'll get you plenty.
Good.
Thank you guys for having me. This was just really fun, and I hope I've
I'm glad.
shared a couple of insightful things. Maybe a couple people heard an aha moment in the midst of this
Oh, I
conversation.
think so. I think so. And I will email you. It's got all these notes on it, but I'll send you my list of where we're going on the
Yeah.
trip so you can see you and Pistol Pete. We're going in September because apparently that's the ideal time to go.
September's
Yes,
a beautiful month, except for here in Florida, it's hotter than hell.
It's
and
not too hot.
Everyone leaves here. in
Well, because we'll be in the desert and you don't
I
want
know,
to
I know. Yeah.
So,
Well, I
Anyway,
guess we're
thank
going to
you.
wrap it up. We can't thank you enough, Dr. Rizzo. It was great meeting you, but the information, especially on the cat heartworm, because I don't think people are aware of that, consumers are aware of that. But Janet, I guess it's time to sign off. So This is Dr. Alice Novotny-Jeroman from Cleveland, Ohio,
And Janet Novotny King, also a Cleveland, Ohio native, saying thank you for listening. Don't forget to follow us, like us, share us, because we love hearing from you. Thanks. Bye.
bye.
Okay.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts, because we love to have those likes. Thanks so much for listening.
That's actually really good.
Oh,
you
good.
could both go bye-bye.
Bye-bye.
You know? Yeah.
How about woof woof?
Speaking of Pets podcast has been sponsored by Vetramax Solvacare Gel, the industry-leading treatment for idiopathic hyperkeratosis. Available from your vet or visit chewy.com to save 15% with promo code VetramaX15 at checkout. Vetramax makes it better. And Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts, because we love to have those likes. Thanks so much for listening.
That's actually really good.
Oh,
you
good.
could both go bye-bye.
Bye-bye.
Well, yeah.
How about woof woof?
This episode of Speaking of Pets podcast was sponsored by Blue Buffalo Veterinary Diets. Love them like family, feed them like family. And Vetramax Veterinary Supply. Vetramax makes it better. Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.